Well, good morning, everybody. Good morning, Bernie. This is Karen Hun, CEO and founder of Silverrock Consulting, where we work with clients on growth strategies. And thank you for joining us for our solutions series, where we're highlighting hero leaders in going through this pandemic. And today we certainly have a hero leader in our minds, Bernie Sherry, who's CEO and Ministry Market Executive of Ascension, Wisconsin. And Bernie, we've known you for a number of years. You've been a beloved client of Silverrock's, and just also sharing with our audience, I do sit on your board. I've been privileged to be invited to join you on your board. And we're just really thrilled to have you with us today. So thank you for taking time of your extremely busy schedule.
Thank you, Karen. Good to be with you.
Bernie, you know, we have the fortunate opportunity to hear from you an insider's view on what healthcare systems have been thinking and doing in the midst of this pandemic. Would you just give us a few highlights of what you've been experiencing on the front line and directly?
Absolutely, happy to do that. The teams responded extremely well. We, early March, when we saw the cases start to increase across the United States, immediately we set up a national command center based out of Indianapolis for our Ascension National System. And then each market, so we have hospitals in 20 states across the United States. We set up market-wide incident command centers. And then in Wisconsin specifically, we had our statewide incident command, and then each facility stood up an incident command. So we could cascade information that we were learning from a national level and internally through the state to the facilities. And what we found in that structure, like you want, is you want quick communication. So we had communication coming down by the minute, by the hour, certainly daily, and cascading that and ensuring that our frontline caregivers were getting the resources they needed was critical. So that worked really well from our national incident command state to our facilities.
Bernie, just because I'm a board member, I've had a little bit of a perspective and would love to point out there's been a lot of coordination on so many levels. I think levels that the public, certainly I as a consumer and a citizen of the community would not necessarily appreciate. So one thing you've shared is the coordination across Ascension as a system. There certainly was also coordination across different hospital systems and competing systems within the geographies within the state. Would you talk a little bit about that and working also with the government and other civic leaders?
Absolutely. Yeah, so as we were preparing in the state as Ascension with our own system, we were also had our chief clinical officers and chief medical officers collaborating and coordinating in each of the HERC regions that we're participating in. So Ascension goes from Racine all the way up to Eagle River. We're in 3 HERC regions. And so we had coordination going on between the health systems in those regions. So just to give you an example, in Milwaukee region, Dr. Brusco, who's our chief clinical officer, he was collaborating weekly with the chief medical officer, chief clinical officers from Greater Children's Hospital, Advocate Aurora, coming together for 2 reasons. One, to understand the increase in cases, and specifically the cases that were being hospitalized. And then that team developed a dashboard of hospital capacity. And so very open and transparent on sharing the capacity as we were being impacted by COVID within our facilities, and an agreement to collaborate and support each other. If one of our hospitals within the Milwaukee region, for example, were to get overrun, we had a clear pathway, protocols defined on how to transfer patients. Fortunately, we didn't have to put those plans in action, but all the health systems had surge planning in place. We were all developing the ability to go to 50% or 100% increase in capacity if needed. So that's the planning that was taking place the end of March into the middle of April.
Well, definitely hats off and our deepest thanks and gratitude for all that you and your team and all the other healthcare professionals and executives have been doing on our behalf. So thank you so much for that. Bernie, I would love to, as you know, it certainly is a healthcare moment, but it's definitely a leadership moment, where crisis happens and there's uncertainty and volatility and ambiguity. Share with us some perspectives that you have from a leadership view. What have you learned that worked well? And in contrast, what were some surprises along the way that you and your team faced and had to pivot very quickly on?
Absolutely. I think the first thing is early on we identified how we were going to set up our incident command and who was going to run the incident command. So identifying the right leaders to put in each section, based on the work that needed to be done and the information that needed to be cascaded. So we quickly put that together, put a physician at the head. Dr. Lisa Benson was our chief medical officer. She led the incident command, and then really thought about the work that was going to need to happen, and then identified key section chiefs that we stood up. So that was an early learning that paid off down the road, is to get the right person. It's like any type of leadership, get the right person in the right role. In a crisis, that's even more important, as we're trying to respond fast with information quickly. I think the learning for me was, as we asked our team members that could work remotely, to go home, we had to quickly get them the tools they needed in their home, so they could continue to be as productive as possible as we were dealing, through the crisis. A couple learnings was, and I've heard this from the team, is how connected we feel we are, even more connected than we were when we were actually meeting in person. How quickly we can get a meeting on the books, like honestly within a day. Where typically, you would say, hey, can you get me a meeting with so-and-so in a week? Meetings are happening, daily, if not the next day. So I find
fast, right?
That's right. That's right. The calendar certainly gets filled up because you're moving, and I think in the virtual world, you're moving from 30-minute and hour meetings to, honestly, you can do 10-minute, 15-minute meetings. It's just easier to do shorter meetings, be very focused on what you're trying to get accomplished, and then move on for the day. Everybody that I've talked to as we've interacted, although the pace, I think, is quite honestly could actually be faster in the virtual world, because you can get connected so easily. Folks have really enjoyed the ability to move faster, rapidly around decision making. I think access to individuals at all levels of the organization has improved immensely. I think as far as lessons learned, I think it's an ongoing lesson that we learned every day. Clarity in communication, just making sure the communication is getting cascaded out into the organization, and then leaders are cascading that information down to the front lines. And there was so much information coming down from the CDC guidance. Guidance was changing daily. Every day we were assessing and reflecting on our communication and making adjustments daily, because that was the most important thing, the effective communication to the front line.
Well, that's pretty rich. Just unpack it a little bit and recap. One of the biggest leadership moments is making sure you've got the right talent in place, especially the talent to lead the broader coordinated effort. And then it sounded like you had a lot of very well organized committees and subcommittees, or certainly tasks, and the step down and the cascading. The other piece you mentioned is very clear communication. And one thing that really strikes me, Bernie, as you talk about all this, is really just the team's agility to read a situation and to move, and the pacing. You talked about the meetings, but also being able to respond to CDC findings and things of that nature. So greater efficiency, greater agility, greater timeliness. And it also sounds like a more intense time and pacing. So those are some of the things I heard you say in maneuvering through it.
Great recap. The other thing I'd add, Karen, is we really learned as a system, functioning as a system, being able to move resources around was key. And so whether it was PPE, the personal protective equipment, whether it was equipment or staffing, and the spirit of the staff, the willingness of the staff to move around where the need was just amazing. to see. And I think just the spirit of responding as a collective team. We have 16,000 associates across the state, and I mean, our leaders and our associates and our physicians, they just could not have been more collaborative and supportive of each other. We put a thank you, sort of a celebration recognition in place every week, where our associates could go out and recognize one of their team members. And that was also, when you're in the midst of, dealing with a, crisis or a disaster or a situation, everybody's running so fast. You have to step back and think, how do you keep the team inspired to continue to go? Because it is a fast pace. Like I said, there's, many more meetings occurring daily, many more timelines you need to meet at a quicker pace than a traditional day. And so how do you keep the spirits up? And thousands of thank yous have come in from all over the state, associates recognizing the contributions of, a teammate. And it was amazing to see.
That's really terrific. So the culture's been built up and the spirit of the people during this time. It's really
Absolutely.
Great. Well, Bernie, we're kind of hitting a phase right now where states are reopening and planning to reopen. Wisconsin certainly is going through its stages. What are some of the things that Essentia Wisconsin is planning? And then if you could also lead into what are some of the points of advice for our listeners as they think about reopening?
Sure. So, our focus right now is preparing. If you think about healthcare and hospitals, we've continued to be open. We did defer elective procedures. The guidance that came out from the coronavirus task force, as well as the Surgeon General. So I think most systems certainly across Wisconsin, the United States, deferred elective procedures. And so, but we've had people coming in, to the ER, both COVID and non-COVID. So as we've been dealing with this, we've prepared our facilities to be able to, what I call, live in both worlds. It's important for us to be able to live in both worlds. But as we think about reintroducing elective procedures, essential procedures, we are taking a very disciplined approach to ensure that our clinics are clean, disinfectant, and we have processes in place to do that on a daily basis as people physically are going to be coming back into our physician offices. Certainly our masking, we have universal masking in our facilities. That's in place. So educating and training our workforce on how to keep themselves safe, but also how to keep the patients coming into our facilities or clinics safe. We're taking time to think about the physical layout within our clinics. So thinking about waiting rooms, is there the ability not to have individuals in waiting rooms? That would be the ideal, but we know that's not always the case. And so we're thinking about social distancing and how do you set up ingress and egress into our clinics? How do you set up the flow of patients to maintain that social distancing? That's also something that our facilities management team is, helping us with. And then as we are thinking about starting back elective procedures, we have a protocol in place around notifying the patients, reaching out. A lot of patients, cases were canceled. So we need to reach back out, get them back on the schedule, also educate them. We're really encouraging folks that need to come back in for procedure if they have the opportunity to, quarantine for 10 to 14 days. We're recommending that if they can. We know that's not always possible, but it's highly recommended. We do screening the day of, and then we also test. So anyone coming back in for an elective procedure within our facilities will be tested to ensure that they're not positive for COVID-19. And if they are, then we'll get them the treatment they need and defer that unless it's urgent, defer that case. We want to protect our patients, and we also want to protect our associates. That's the number one is those two. So we're trying to do everything possible get our facilities ready.
What advice do you have for our listeners as far as a couple of tips on how they should think about reopening and re-entering?
Sure. And I think from what I've heard in the business community, a lot of folks, I've been on many calls with CEOs of companies and just been impressed of how diligent they are thinking about the safety of their associates. And so if you think about reopening the business and being productive again and starting to manufacture, or if it's in the retail space, sell consumer goods, if you don't protect your associates, that's probably the first thing that could impact, productivity or production or sales. So I think I've heard, certainly if they're essential, they need to come back in, say on a shop floor or in a retail setting. How do you set up again the ingress, egress related to retail? How do you structure that so you can maintain social distancing? Think about masking for sure. And then a lot of companies, CEOs that I've talked to, really taking a look. We've been working in this virtual remote environment for the last 2 months. And so I think folks are stepping back and really being thoughtful and cautious and doing it in a phased approach to bringing those that can work at home back into a physical environment. You need to ensure that your physical environment is set up in a way that you can protect your associates and practice that social distancing. And what I've heard, Karen, is companies really being thoughtful and doing everything they can in a phased approach to have individuals work from home if possible. So they're not rushing to bring back, a full office of associates into a high rise, of being very thoughtful. And so that's what I would encourage to others that haven't thought through that is, if you can have folks work from home and maintain productivity, I recommend doing that. Certainly if they need to come into the office space, be very thoughtful on how to set up the office space and protect your associates.
Wow. Thank you, Bernie, for that. It definitely sounds like Ascension Wisconsin is taking very methodical, deliberate, conscientious steps around patient flow, patient safety, associate safety, all across the board, from traffic flow to all the equipment, and also adhering to the guidelines and really stepping above that. And it sounds like that is also your advice to others who are opening up, to just be really thoughtful about kind of the human flow in and out, egress, ingress, in the human contact. And I think implicit too with a lot of things you've been saying throughout today is also to be conscious and cognizant of the human spirit and people's emotions as they're going through this, whether or not they're ready to come back or not. So to really be kind of 360, holistic view all the way through.
That's right.
Well, Bernie, we thank you so much for your time. We know it's very precious. And again, just our gratitude to you and all the healthcare workers for what you're doing. And we couldn't do this without you. We're so grateful for your training and also the spirit in which you all are delivering care and ensuring that we're all in as good as a place as we can be.
Thank you, Karen.